Cardiopulmonary resuscitations or CPR is a life-saving technique useful in many medical emergencies, including a heart attack or near drowning, in which someone breathing or heartbeat has stopped. For the public or bystanders who witness an adult suddenly collapse, compression only CPR or hands only CPR. Hands only CPR is CPR without mouth to mouth breathe. It is recommended for use by people who seen a teen or adult suddenly collapse in or out of hospital settings such as at home, at work, or in park. In adult victim of cardio arrest, it is reasonable for records to perform chest compression at the rate of 100 to 120 minutes and to depth of at least 20 inches, and excessive chest compressions depth greater than 2.4 inch